Hi, I'm Deborah Muhammad Ali. I'm here today to talk to you about strategies to reduce hospital readmissions for heart failure. It has been estimated that by the year 2030, Medicare funds will be significantly decreased. Without reform now, Medicare as we know it may not be available for future generations. Effective October 2012, as part of Medicare reform, the Hospital Readmissions Reduction Program was initiated. This program requires Centers for Medicare and Medicaid Services to reduce payments to hospitals with excessive readmission rates for heart failure patients. New advancements in healthcare have led to increased life expectancy. This increase in life expectancy, as well as an aging baby boomer population, has led to unforeseen financial stress on the Medicare system. According to a 2015 report by the Centers on Budget and Policy Priorities, Medicare trustees find that Medicare is capable of paying 100% of the cost of coverage until the year 2030. By 2030, incoming taxes and revenue will remain sufficient enough to cover only 86% of the Medicare costs. And by 2050, it will only be sufficient enough to cover 80% of Medicare costs. Facing financial strains and concerns for its future, Medicare set out to reform its policies on reimbursement of services in hopes of relieving future financial burden to the system. Under the Obama administration, the Affordable Care Act was initiated. In October 2012, Section 3025 of the Affordable Care Act added Section 1886Q to the Social Security Act, establishing the Hospital Readmissions Reduction Program. This program was aimed to reduce reimbursement payments made to hospitals for heart failure patients that were readmitted within 30 days of discharge. Heart failure is a chronic dysfunction of the heart in which the muscle wall has weakened and the heart is no longer able to effectively pump blood out to the body. Common causes for heart failure are MI, hypertension, and cardiomyopathy. Because heart failure is a chronic condition that worsens over time, frequent readmissions may be required if it's not managed properly. In a study published by the Journal of American Medicine Association, January 23, 2013 issue, readmission rates for heart failure patients were examined between 2007 and 2009. The study concluded that out of 1,330,157 Medicare patients, 329,308 were readmitted for heart failure within 30 days of discharge. That's approximately 24.8% of patients. Of those 329,308 patients, 31% were readmitted within 0 to 3 days, as you can see on this chart, 33% within 0 to 7 days, 34% within 0 to 15 days, and 35% within 0 to 30 days. Naturally, any reduction in reimbursement is of great concern for many hospitals because the cost of caring for these patients has not decreased. Yet the amount of money being reimbursed to the hospital has, causing financial loss to the healthcare institution and posing a threat to its ability to remain open. Faced with new policies regarding reimbursement, many hospitals are adapting approaches for proactively managing readmissions for heart failure. Today we will discuss important strategies being employed by hospitals across the country today in an effort to reduce heart failure readmissions. These strategies include core measures, education, transition of care nursing, follow-up. Let's explore these strategies. In 1999, Joint Commission assembled a team of professionals to adapt a standard of care for several common conditions that are high risk for readmissions and complications, such as acute myocardial infarct, heart failure, and pneumonia. These standards of care have been proven effective as treatment plans for reducing complications and preventing readmissions. For today's lecture, we will discuss core measures for heart failure. Upon every heart failure admission, a core measure pathway is initiated. Currently, the core measures for heart failure include prescribing an ACE inhibitor and a beta blocker. ACE inhibitors are medications that block angiotensin, allowing the blood vessels to relax, as well as release water and sodium through the urine. This reduces the strain on the heart muscle. Beta blockers should also be prescribed. Beta blockers are drugs that work to slow the heart rate and therefore reduce the heart's demand for oxygen. This drug combination allows the heart time to rest and may hopefully improve its cardiac function. Another important measure for treating heart failure is the evaluation of the left ventricle of the heart, known as the ejection fraction. Ejection fraction refers to the amount of blood pumped out of the left ventricle of the heart with each contraction. A normal EF should be between 50 to 60%. It is imperative that those patients whose EF is less than 40% be monitored closely and be on a drug regimen that includes an ACE inhibitor and a beta blocker. This leads us to our next strategy, education. We need to be proactive in educating not only our patients, but their family and their caregivers. Patients need clear instructions on diet, medication, and warning signs of impending crisis. Patients and caregivers should also be educated to weigh themselves daily. A proper weight should be done at the same time every day on the same scale, and weight should be recorded. Any weight gain greater than 3 pounds should be reported to a physician. Patients should be educated on their medication routine, their side effects, and the purpose of their medication. These are all key factors in medication compliance. Assess the patient's financial resources as well. Patients on a fixed income may have difficulty purchasing their medications. A case manager can assist these patients with community resources and assistance programs. Teach-back education is the most effective means of education. This means asking the patient to paraphrase what they have learned to assess their level of understanding. Many hospitals are hiring transition of care nurses. Their job is specific to monitoring and educating and following up with heart failure patients throughout their hospital stay and beyond. Transition of care nursing is an up-and-coming position in today's job market. These nurses are instrumental to preventing readmission. They make follow-up calls with the patient weekly until the 30-day mark to monitor their health remotely and reinforce their education. This brings us to the final piece, follow-up. Follow-up after discharge is important to monitor a patient's health and to correct any changes before it becomes a crisis. Studies show that a follow-up visit with a physician within 7 days of discharge can prevent readmission. Follow-up is also conducted by home health nurses in the community as well as by the transition of care nurses. Many hospitals have sent representatives to nursing homes and rehabs to improve the heart failure education. In closing, heart failure is a chronic condition which is difficult to manage but not impossible. While there's no clear-cut way to prevent all hospital readmissions for heart failure, with these strategies we can hope to reduce the number of readmissions and relieve some of the burden on Medicare, helping to preserve its funds for future generations. Thank you.